regarding chronic disease, and you speak to mothers and their families. The Surgeon General needs to be an effective and truthful communicator, a calming voice of reason, a steady hand of experience at a time when so many, for whatever reason, sow distrust and confusion. The Surgeon General must be someone who can execute on President Trump's commitment to restoring confidence in public health and to assure the American people that our institutions are making science-based decisions rooted in data that puts families' health first. This is especially important as HHS undergoes substantial personnel and policy changes. Dr. Means, it should be your mission and the mission of every HHS official to restore stability and assure Americans that protecting health is the top priority. I look forward to learning more about your public health priorities and views. With that, I recognize Senator Sanders.
Thank you, Mr. Chairman, and thank you, Dr. Means, for being here. Congratulations on your baby.
Thank you.
Today, we are considering President Trump's nominee to be the next Surgeon General of the United States. The Surgeon General is considered the nation's doctor, a trusted leader who tells the American people the truth about science and medicine. Previous Surgeon Generals have warned the American people over the years about the dangers of smoking, drunk driving, loneliness, providing recommendations based on scientific evidence, not ideology. Dr. Means, you have made it clear to us that you believe it's time to, quote unquote, make America healthy again. That is a great slogan that I expect that everybody up here agrees with. In America today, we have a very unhealthy society, and there are a lot of reasons for that. The chairman mentioned some of them. But perhaps the most important reason is that we have a healthcare system that is broken, that is dysfunctional, and in fact is very cruel. In America today, we spend over $5 trillion a year on healthcare. Believe it or not, that is more than $15,000 for every man, woman, and child in our nation, twice as much per person of nearly any other major country. And yet, despite that huge expenditure, we remain the only major nation on earth that does not guarantee health care to all people as a human right. The result, over 85 million Americans are uninsured or underinsured. More than 500,000 Americans go bankrupt due to medically related debt, and 68,000 Americans die every year because they cannot afford to see a doctor. If anybody in the world thinks that that is a rational healthcare system, you're living on another planet. In terms of life expectancy, we live 4 years shorter on
That means you're extra.
while others wait months to get seen. Yes, Mr. Chairman, we must make America healthy again. Unfortunately, the problem is that since coming into office, President Trump and Secretary Kennedy have done the exact opposite. As a result of massive cuts to Medicaid and the Affordable Care Act, 15 million people will be losing the health care they had. Studies suggest that when you throw 15 million Americans off of health care and make over $1 trillion in cuts to Medicaid and the ACA, some 50,000 of our fellow Americans will die unnecessarily each and every year. Secretary Kennedy and the Trump administration continue to spread dangerous conspiracy theories about vaccines, making it harder for Americans to protect their children from deadly diseases. I am having a hard time understanding how any of this will make America healthy again. In my view, we need a Surgeon General who has the courage to take on President Trump and Secretary Kennedy and say, no, it is wrong to throw 15 million off of healthcare. It's wrong to double premiums for 20 million more Americans. It's wrong to spread misinformation about vaccines. And that's just not me talking. That's precisely what 6 former Surgeon Generals, 3 Republicans, and 3 Democrats who served under Trump, Obama, George W. Bush, Clinton, and George H.W. Bush have told us. In an op-ed they wrote in the Washington Post, that's what these guys wrote. A few months ago, they said, quote, "The actions of Health and Human Services Secretary Robert Kennedy Jr. are endangering the health of the nation. He has rejected science, misled the public, and compromised the health of Americans," end quote. That is Republicans and Democratic former Surgeon Generals. So, Mr. Chairman, there is a lot to be discussed, but I have very serious questions about the ability of Dr. Means to be the kind of Surgeon General this country needs. Thank you very much.
Dr. Marshall will introduce the nominee.
Thank you, Mr. Chairman. I'm certainly humbled and honored today to introduce Dr. Casey Means. I want to thank you for joining us here this week. I'm especially glad we're able to hold this meeting, which was long overdue. But being in labor is one of the best excuses we've had to delay a hearing. So congratulations to your family. We hope baby boy Phoenix, 17 weeks old today, is doing great. And again, we appreciate you being here. As my colleagues have already said, today nearly 8 in 10 adults, representing almost 200 million people in this country, live with at least one chronic disease: obesity, diabetes, heart disease, hypertension. Our children, the pride of this nation, the situation is equally alarming. Approximately 20% of our youth are obese. 1 in 3 adolescents age 12 to 17 have prediabetes, 1 in 3. And when it comes to our mental health, at least 1 in 5 American adults, 60 million people experience some form of mental illness each year. Those are epidemic numbers. We need a Surgeon General, the nation's doctor, to guide us back to health, mobilizing science-based strategies to prevent disease, promote wellness, and address these epidemics head on. The Surgeon General serves as our country's chief health educator, but more than an educator, a coach, a cheerleader, providing evidence-based guidance to improve health and respond to crisis while leading the U.S. Public Health Service Commission Corps and advising on key policies. Over the course of this process, I've truly enjoyed reading Dr. Means's books, her publications, and getting to know her and hearing her thoughtful vision for improving the health of Americans. Dr. Casey Means is uniquely qualified, Stanford-trained physician who began surgical training at Oregon Health and Science University, where she excelled in clinical performance and patient care for underserved populations before leaving that traditional system. Like many of us, she was disillusioned by its focus on treating symptoms versus addressing the real causes. She left it to champion preventive metabolic health. She co-founded Levels Health, using innovative glucose monitoring to empower metabolic health insights, and authored the best-selling book, Good Energy, which I'd recommend everybody on this committee to read to better understand exactly who she is. She offered science-based strategies to prevent chronic illnesses through lifestyle changes. Dr. Means brings a forward-thinking vision focused on prevention, innovation, and patient empowerment. She is a proven communicator. She's appeared on over 200 podcasts. She's a faculty course director at Stanford. She's been featured in articles in the Wall Street Journal, Forbes, New York Times. She inspires, educates on complex health issues. She's poised to shift us from reactive sick care to proactive health care, emphasizing metabolic health to truly make America healthy again. Her entrepreneurial spirit and clinical background would drive solutions, prioritizing outcomes over bureaucracy, aligning with the Make America Healthy movement again. So that's my formal introduction from my heart, from my heart. Go back to our childhood, in my childhood in the 1960s, everybody smoked. Everybody did. But a Surgeon General, Dr. Luther Terry, under LBJ, had the courage to stand up and say, smoking causes lung cancer. He wasn't able to finish the job. It was then under President Nixon that the next Surgeon General, Dr. Jesse Steinfeld, stepped forward and educated children who then educated their parents on the hazards of smoking. Something that I see every day, my kids educating me on what good nutrition, healthy nutrition looks like. And then who can forget Surgeon General Dr. C. Everett Koch, who gave us moral and scientific clarity during the AIDS epidemic. And that's what I think Dr. Means can be. I think that she can move the needle. We do have a chronic health epidemic. No one can deny that. And like I said before, we need a Surgeon General who's more than an educator. We need a coach. We need a communicator. We need a cheerleader to address these chronic diseases. And I believe that Dr. Casey Means is the person for the job. Thank you, Chairman.
Thank you. Dr. Means.
Thank you. Good morning, Chairman Cassidy, Ranking Member Sanders, and members of the Senate Health Committee. I want to thank President Trump for nominating me to serve as Surgeon General and for Secretary Kennedy for his support. Thank you for also being willing to postpone this hearing. When I went into labor 5 hours before the hearing started in October, our precious baby boy was born on the hearing day. As a physician, I have always been inspired that the root of the word healing means to return to wholeness. Nothing is more urgent than restoring wholeness for Americans, physically, mentally, and societally. We are now the most chronically ill, high-income nation in the world. We live shorter, sicker lives than peer high-income nations. Today's children are projected to live shorter, sicker lives than their parents. We spend trillions annually on reactive sick care. Nearly 150 million Americans are on federal healthcare programs, and we spend $50 billion per year on research. Yet outcomes are worsening and disparities are widening. Our nation is angry, exhausted, and hurting from preventable diseases. Rates of high blood pressure, many cancers, autoimmune conditions, type 2 diabetes, mental health disorders, dementia, neurodevelopmental challenges, and youth suicide have all increased in the past 2 decades. This public health crisis is touching every American family. It is robbing our children of possibility, our workforce of productivity, and our nation of security. It strains our federal budget and dims hope for millions. We must confront this epidemic through a vision grounded in science, dignity, shared humanity, and
अभी क्या और कितनी देर 8 बजे का रिजर्वेशन है
बस आ रही हूँ 2 मिनट
ठीक है
अवीरानी 2 मिनट में रेडी होना हो कुकु
leaders must address the evidence-based, modifiable drivers of chronic diseases, which include ultra-processed foods, industrial chemical exposure, lack of physical activity, chronic stress and loneliness, and over-medicalization. I've been asked to help our nation get healthy and answer the call of millions, especially mothers, who are begging for transparency and support. That is what I'm here to do. I believe that every American shares a core yearning to thrive and help their families thrive. But we are asking people to make healthy choices in environments that are squarely structured against them. Good policy and education can make health easier, more affordable, and more accessible. I know our current leaders at HHS and across the federal government are committed to the ambitious policies outlined in the MAHA strategy released last year that focuses on advancing research, aligning incentives, increasing public awareness, and fostering private sector collaboration to end the chronic disease epidemic. Specific efforts are already underway to fund and promote more whole, healthy food for Americans, address financial conflicts of interest in our agencies, fund research focused on disease prevention and reversal, and make institutions accountable to measurable health outcomes for all Americans. President Trump and Secretary Kennedy have invited a mature, candid, grand conversation about how our medical education and fixing perverse incentives can pull us back from the brink. And for this, I am profoundly grateful. My professional history has prepared me to meet these very complex times as an innovative, unifying, and practical leader focused on reversing chronic disease. Over the past 15 years, I have treated thousands of patients in clinics and operating rooms. I have run my own medical practice and co-founded a health technology company that empowers individuals with metabolic health data to address blood sugar dysregulation, a problem now affecting over 50% of American adults and 30% of teens. In this role, I recruited leading researchers from Yale, UCSF, Brigham Young University, Cleveland Clinic, and more to support this effort. And the company launched a 10,000-person a 10,000 participant academic industry research collaboration on early metabolic disease detection. I've held biomedical research positions at the National Institutes of Health, Stanford University, New York University, Oregon Health and Science University, and published this biomedical research in leading medical journals. I was recruited as a faculty course director at Stanford University, where I taught undergraduate and graduate students on nutrition and health. I have served as an associate editor of an international medical journal focused on prevention and disease reversal. I have spoken internationally on chronic disease and wrote one of the most successful health books of the decade, outlining a vision for reversing this epidemic through personal empowerment, culture change, and policy reform. I graduated from Stanford University with honors and from Stanford Medical School, where I was inducted by unanimous faculty vote into the Honor Society for Patient Care. In conclusion, mental and physical health are unraveling from shared root causes that we can fix. Preventable heart disease, our #1 killer in men and women, is emblematic of a nation with a broken heart. Diabetes, representing cellular energy collapse, is draining our human potential. Dementia, depression, and neurodevelopmental decline reflects a society losing its mind. Our bodies are telling us this current path is totally unsustainable. There is another way, a path that unites rigorous science with reverence for our miraculous bodies and planet, and brings Americans and our medical institutions together around actual healing and prevention. This path is also economically sound, with the potential to save trillions of dollars annually. As I sit here in the early months of motherhood, I feel profound awe at the privilege we have as adults to create a better world for future generations. And that is why I'm here. As Surgeon General, I would call on every American and the Public Health Service to join in a great national healing, one that halts preventable chronic disease, makes healthy living the easiest choice, honors the body's connection to the environment, and puts America back on the road towards wholeness and health. I look forward to answering your questions. Thank you.
Thank you, Dr. Means. I'll start. If confirmed, you'll be the nation's doctor. And to better understand your best medical opinion on various topics, I'll ask you some things that have been of concern to this committee. I have 7 things to ask in 5 minutes, so please be tight. There won't be trick questions. Do you believe that the abortion pill, mifepristone, is safe and should be prescribed without an in-person visit with a physician?
Thank you so much, Senator Cassidy, for your question. And also thank you so much for meeting with me virtually before the hearing, and also to your staff for meeting. I think that every medication has risks and benefits. I think that all patients need to have a thorough conversation with their doctor and have true informed consent before taking any medication.
Should there be an in-person visit required?
This is the question of whether it should be an in-person visit is out of the purview of the Surgeon General's office. But I do believe that every patient needs to have a very thorough conversation with their doctor before taking any medication. Unfortunately, in our current healthcare system, because of how overburdened doctors are, this often doesn't happen, whether it's in person or online.
Do you believe that birth control is safe, should be widely accessible, including perhaps without a prescription?
I absolutely think that oral contraception should be widely accessible. Just as I said with mifepristone, I believe that especially when it comes to oral contraceptives, we need to have patients having a conversation with their doctor about risks and benefits. Like all medications, oral contraceptions do have significant risk, and we need to make sure that women are empowered with information and informed consent before getting on a medication that's often prescribed for several years without follow-up.
Tragically, next question, we've had 2 children die from measles in West Texas. We now have an outbreak of like 1,000 children almost in South Carolina area. You're a mom. We're on the verge of losing our measles elimination status. Would you encourage other mothers to have their children vaccinated against measles with the MMR vaccine?
like you, I'm a physician. I believe vaccines save lives. I believe that vaccines are a key part of of any infectious disease public health strategy. And I would work with you, the CDC, the NIH, ACIP,
But would you encourage
FDA.
mothers to vaccinate their children with the MMR vaccine, seeing how we've had children die in this outbreak in South Carolina?
I'm supportive of vaccination. I do believe that each patient, mother, parent needs to have a conversation with their pediatrician about any medication they're putting in their body or their children's
You're the
bodies.
nation's doctor. Would you encourage her to have her child vaccinated?
I'm not an individual's doctor, and every individual needs to talk to their doctor before putting a medication in their body. I absolutely am supportive of the measles vaccine, and I do believe vaccines save lives and are an important part of the public health strategy.
We've had a tough flu season this year. Would you, as past surgeon generals have, encourage Americans to get vaccinated with the flu vaccine?
At the risk of sounding repetitive, I do think it's very important as a physician and to rebuild trust in public health to make sure that patients are encouraged to have informed consent with their doctor before getting any medication. I believe vaccines save lives. I believe they're an important part of public health. I also do not want to not encourage patients to have a conversation with their doctor. I think it's incredibly important. Informed consent is going to be part of building trust in public health.
We've had an outbreak of whooping cough in Louisiana. Usually or collectively contribute to autism?
Senator Cassidy, you're a physician, I'm a physician. The reality is that we have an autism crisis that's increasing, and this is devastating to many families, and we do not know as a medical community what causes autism. The administration has just committed a huge amount of funding to look at the exposome of all environmental factors that could be contributing to autism. And until we have a clear understanding of why kids are developing this at higher rates, I think we should not leave any stones unturned.
There's been a lot of evidence showing that they're not implicated. Do you not accept that evidence?
I do accept that evidence. I also think that science is never settled. And I think that the effort to look at comprehensive cumulative exposures of our exposome into what is causing autism is important. And I look forward to seeing those results and sharing the best public health information with the American people.
Well, I got through 5 out of my 7, so thank you for cooperating. Senator Sanders.
Thank you. And like the chairman, I've got a lot of questions in a short period of time. I enjoyed your opening remarks, and I think you're right. This is a country that is sick in many ways. We need to focus on disease prevention rather than spending a huge amount of money on tertiary care. And I've enjoyed and appreciated some of the remarks you have made in the past. So let me just see if we're on the same page here. When I was sitting where Senator Cassidy is now, I fought hard to have much more substantive labeling on junk food. In fact, it's my view that we should not have food manufacturers selling junk TV ads. My understanding is you have come out against junk food ads on television. Is that correct?
Yes.
Can you just take 30 seconds to elaborate that? Would you use your position to ban junk food TV ads?
Thank you so much, Senator Sanders. And I agree with you completely. I think there is so much that we agree on these issues. Just to be clear, the Surgeon General's office does not have the purview to ban this.
But you have a voice.
Absolutely. And that's a voice I would absolutely lend to talking about the dangers of ultra-processed foods and getting these advertisements off TV. This has long been a part of my message. I talk about it in my book.
Senator Marshall mentioned earlier ago the crisis we have in obesity, childhood obesity. And you have these manufacturers selling sugar-laden products that cause obesity.
Yes.
So you will speak out, and do I understand your view is you would fight to ban TV ads of junk food?
I think you will be frustrated by how much I will be talking about ultra-processed foods.
Good. I won't be frustrated. I would be delighted. All right, let me ask you another area that we may have some agreement. As you know, the United States and New Zealand are the only two countries in the world that allow the pharmaceutical industry to advertise on TV. I believe we should ban those ads. How do you feel?
I agree with you.
Okay.
I mean, just to elaborate, as you know, but for anyone who might be listening, about 65 to 70% of the calories that our children are eating are ultra processed frankenfoods made in factories that are so disconnected from their origin, source, and nutritional value that, we're putting just nutritionally devoid food in our children. And then we wonder why we have an obesity crisis in children and why chronic diseases are rising as early as
No, you're right.
toddler years. So
No, that's right.
my vision in this role is to get more whole, healthy foods on American plates.
And we spend a fortune.
Fortune.
We make people sick, and then we spend a fortune trying to keep them alive. All right. Those are important areas of agreement, and I appreciate that. But I want to pick up on an issue that the chairman raised, and it's a terribly important one, and that deals with vaccines. And I think the answers you gave us were a little bit political and not to the point. The American Medical Association, I don't know if you're a member of it or not, is the largest professional association of physicians representing over 270,000 doctors. And they wrote in November that, quote, an abundance of evidence from decades of scientific studies shows no link between vaccines and autism, end quote. In contrast, Secretary Kennedy has said, quote, I do believe that autism does come from vaccines, end of quote. Dr. Means, who is right? Is the AMA right? Is the scientific community right? Or is Secretary Kennedy right?
As I said to Senator Cassidy, we have a situation where autism is rising.
It is.
This is a huge problem.
It is, but we don't want conspiracy theories to
Absolutely. I 100% agree with you. And also, as a biomedical researcher and physician, I am not going to sit here and say that we should not study something in the future. It's not a political answer.
We should study everything.
We should study the different factors that may be causing.
I agree. But you have scientific evidence, the overwhelming body of scientific evidence says vaccines do not cause autism.
So just to be very clear, vaccine advocacy has never, or any anti-vaccine rhetoric has never been a part of my message. I don't mention the word vaccine in my book. This is not a part of my core message. I am not here to complicate the issue on vaccines. And also, I, as a physician, am very careful with my words. And I don't think it's responsible to say that we're not going to study when kids are getting many medications. I think it's important to just keep it on the table.
Last question. I'm sorry, we're running out of time. We are the only major country on earth that does not guarantee healthcare to all people as a human right. Dr. Means, is healthcare a human right? Should the United States join every other major country and say to everybody, whether you're young, old, rich, or poor, you are entitled to healthcare as a human right? Yes, no, maybe?
My focus is on ensuring that Americans have access to the best healthcare in the entire world, which, as you talked about, as I talked about, as everyone who's spoken has talked about, is pretty much the opposite of what we have right now. We spend 2x every other country in the world, and we have the worst.
I agree, but is healthcare a human right? Will you join me in fighting for a national healthcare program?
I will be by your side trying to get Americans access to the best healthcare in the world.
Thank you very much.
Senator Mullen.
Thank you, Chairman. My green light was on. I thought my mic was on. I want to address a couple of things. During the ranking member's opening statement, he talked about misinformation coming from this administration. And I just want to point out that the Biden Surgeon General, Dr. Murthy, was actually, a court actually ruled against him in 2023, the Fifth Circuit Court, for trying to censor free speech on social media. That's misinformation. And so for us just to throw out an accusation like that with no evidence when the ranking member was completely silent when that took place, it's really some hypocrisy there. When we start talking about healthcare not being affordable, the ranking member and I actually agree on that. The problem is you supported the same tools that got us to where healthcare is unaffordable, because ACA, affordable healthcare, which is completely unaffordable, has risen 3 times faster than inflation itself. Yet We still support it. Not we, you, the Democrats.
No,
still
I support
it.
a national health care program which will
Yeah.
cut the cost of
I'm
health
sorry,
care
it's my
per person.
time. It's
But you're
my time.
attacking me.
No,
You're
I'm
going
pointing
to
out
attack
facts.
me. I'm
No,
going to respond.
I'm pointing out facts. You can say what you want. I'm just pointing out facts.
No,
The
you're
fact
putting out lies.
is that it is rising 3 times faster, and we know it. Yet we still want to sit here and defend it. The ranking member wants us to talk about all the death that is supposedly going to be happening because of President Trump and Secretary Kennedy, because how dare they look at a healthcare system that is broken and unaffordable and try to make changes. But yet the definition of insanity is what? Doing the same thing, expecting different results. So we should just sit here and accept it. And how dare we look into vaccines to just simply look to see if maybe vaccines may be a partial cause to autism when it's rising at a rate faster than any country in the nation. How dare us look at science? Oh my goodness. Science is supposed to be perfect. I thought science was always supposed to be studied. I'm for looking into it. As the father of 6 kids, yeah, I want to look into it. I want to know what's causing it. And I will turn over every stone. And so Dr. Means, thank you for saying, I want to turn over every stone. Good on you. I'm not a doctor. I'm not sitting here trying to say we shouldn't do something. I'm saying, let's go after it. Let's look at it. Let's question what we're doing. Let's look at the healthcare system. We can agree on that one. I just don't want to socialize it, but we can agree that it is absolutely not affordable. 100% not affordable. Yet it was supposed to be affordable. That's what we was sold by Obamacare. So how about we work together and say, hey, so scrap ACA, admit it doesn't work, admit you guys made a mistake, and let's work at something with President Trump to make affordable healthcare healthy and affordable for everybody. But there's zero chance you guys could do that. Zero chance. Yet everybody we bring up here, you guys chastise for trying to make changes. God forbid we change and go after try to fix our broken system. Anyways, I ranted too long. Let's talk about some.
Yes, you did.
I'm sorry, I didn't ask your opinion on that. And if I cared about your opinion, I would ask you, but I don't care about your opinion.
Well,
you're part of the system. You're part of the problem. You've been sitting here longer than I've even been alive. This is your problem. You should have fixed this a long time ago. You've been railing on it so long. What have you
I've
been doing?
decided not to run for Surgeon General. You're the nominee. I've decided
That
not
is
to accept that nominee.
That is definitely something we would never accept. Ma'am, what's your passion about healthcare? What brought you into this?
Thank you, Senator Mullen. For all of us, I'm just going to take a deep breath. My vision for Surgeon General and for the future of America is to get more healthy, whole food on Americans' plates and to work to systematically encourage our healthcare system to focus on the root causes of why we are sick and not just reactive sick care. This is my passion. This is why I was put on this earth. We have an incredible healthcare system. It's amazing. It's produced miracles. If we have an acute issue, absolutely you want to be in America to get that fixed. But 90% of healthcare costs are now going to chronic diseases. And frankly, having practiced, I've seen thousands of patients, worked in this.
Gas on kar दूं?
Presenting India's first Android chimney from Beyond Appliances. YouTube, serials, movies, sports. अब cooking के साथ entertainment भी. Beyond Appliances. Engineered to delight.
Amazing emerging work in systems biology and network biology that the physiologic causes of the vast majority of diseases that are taking American lives and torturing and shortening our lives, even in our children, are connected by shared physiology and shared root causes. We need to upgrade the paradigm of the American healthcare system to educate and treat in that way. It is by far the most efficient way to treat, of course, because if we're addressing shared root causes, we're going to be able to stop the whack-a-mole medicine that's not working for us and that is so costly. And so my passion is to help work with the AMA, work with medical schools, work with Democrats, Republicans, all sorts of agencies across the government to ensure that we really move the needle on shifting the American healthcare system towards root causes. I know we can do it. There's political will. It's what Americans want. Even the medical schools are on board, but we need a vision to get there.
Thank you.
Senator Murray.
Thank you, Mr. Chairman. Thank you, Dr. Means, for being here. Let me start with this. You called birth control pills, and I'm going to quote, a disrespect of life. And you said Americans, quote, use birth control pills like candy. You also claimed, contrary to established science, that hormonal birth control has, quote, horrifying health risks for women. Now, here are the facts. There are 18 FDA-approved contraceptive methods, both hormonal and non-hormonal, and there are decades of evidence showing that every one of these birth control methods is safe and effective. So I wanted to ask you, help me understand, should women trust the FDA, which approved all 18 methods of birth control after a very rigorous look at the evidence, or should they trust your statement that there are horrifying health risks to birth control, which contradicts that evidence?
Thank you, Senator Murray, for your question. I'm curious if you're aware of what the side effects of hormonal contraception are.
I'm curious if you are with the FDA that went through all of these and rigorously looked at them, or as Surgeon General, if you're going to tell the truth to the American people.
I absolutely believe these medications should be accessible to all women. And also, all medications have risks and benefits. And in our current medical climate, with the burden on doctors, doctors do not have enough time for thorough informed consent conversations. Some of the horrifying side effects of birth control that I have mentioned include blood clots and stroke risk in women who have clotting disorders, who are smokers,
So
who
is
have
it
obesity.
general?
No, it's not general. I'm very careful with my words. And when I say those comments, which are taken out of context, I'm speaking about particular women that can be hurt if there is not informed consent about their medical history, their lifestyle exposures, and their family history. I want those women, and I know you do too, to be able to have a thorough conversation with their doctor and know whether they are at higher risk for side effects when prescribed the
saying
medication.
that is one thing, but saying on, different shows that birth control pills are a disrespect of life is very different.
I
It's
believe I
very
am
different.
passionate about
Very
women's health, and I think it is
Saying that
disrespectful
people use
to
birth
women.
controls like candy is very different than what you just said.
We prescribe a huge amount of hormonal contraceptive, and I do not believe most of those conversations have informed consent because of the pressures that doctors are under because of our broken healthcare system. I want what's best for women, as do you, and I want every woman who could be at risk
I just
for a
have
side
2 minutes
effect
left and I have other
to
questions.
know
Let me move on. Thank
if
you.
a woman died from a
Dr.
stroke or a
Means,
blood clot because they did not have a thorough
Thank you
conversation.
for your answer. You made that clear. Let me go to another question. Tracy Beth Hogue, she's an anti-vaccine skeptic. She was elevated by the Trump administration to serve as the top drug regulator at FDA. She made comments last week casting doubt on the safety of RSV vaccines for baby. As you sure know, RSV can be deadly even for healthy full-term infants. Do you believe that Dr. Hogue is wrong to question the safety of RSV vaccines?
I have not read that article or seen that quote. I would need to know what she said before I commented on that.
Well, you do know that RSV is the leading cause of hospitalization for infants.
I have a 17-week-old, and I'm very aware of that.
You hear her statement as Surgeon General. Would you contradict it?
I certainly have absolutely no issue having very frank conversations with anyone in the administration if I believe that their statements are misguided in some way or not fully informed. That's not a conversation I would have publicly first. I would have a private and direct conversation with anyone in the administration if I felt that patients were at risk because of.
All right, and I also want to ask you about maternal health. Mental health conditions are the leading cause of maternal death in the US, including suicide and overdose deaths. In her comments last week, Dr. Hogue, same woman, also expressed concern about the safety of the antidepressants during pregnancy. Specifically, she called out SSRIs, the most commonly prescribed type. Do you believe that SSRIs are dangerous for pregnant women?
I don't want to be a broken record here, but I do believe that every medication has risks and benefits, and you need to have a nuanced conversation with your doctor before starting a medication. That is, I think, the most responsible position for any doctor to share.
Well, strong evidence has shown that SSRIs are safe in pregnancy. Most do not increase the risk of birth defects.
Certainly.
But untreated
Certainly.
depression in pregnancy puts women at risk.
And I agree with you, but I still think a patient, I don't think it's responsible to make a blatant statement for all Americans.
Okay, well, if confirmed as Surgeon General, it will be your job to give accurate and up-to-date health information to the American people. I assume you will take that
I will.
responsibility seriously.
I absolutely do. And I also believe that the American people are looking for a more nuanced conversation about health. And I believe that that will help restore trust in public health.
Thank you.
Coach Tuberville.
Thank you, Mr. Chairman. Dr. Maines, thanks for being here. Congratulations on expanding your family. And I know it's an exciting time for you. I also want to thank Assistant Secretary of Health, Dr. Brian, Christine, for being here. Thank you for your service. Dr. Maines, I've listened to you and your brother, Callie, and I know he's here today on, I don't know how many tens and tens of podcasts I've listened to. I learned a whole lot. Because I grew up in the health business as a coach, 35 years is all about nutrition. So the question I want to ask you is, how do we get around this? I talk to people in the healthcare business, and in the medical field, when we train our doctors, we don't teach anything about nutrition. Everything's about a priority, and those priorities are fine, but we need to teach our doctors and nurses about nutrition, about what to put in their body. This epidemic we have going on chronic disease, as we've all talked about, is out of control and getting worse. So how do you prioritize that?
Thank you so much, Coach. And I really, really enjoyed getting to know you throughout this process. Thank you. This is so key, what you're talking about. Reforming medical education to focus on root causes. And one of the key root cause modifiable factors of chronic disease is nutrition, as we all know. There has been incredible momentum already in the administration towards making this possible, starting with the Dietary Guidelines for America, which came out about a month ago. This is the first time we've had a full-throated denunciation of ultra-processed food. And I think this is historic. It's historic when the federal government says that out loud. What that is going to do is impact medical education. It's going to impact procurement regulations for billions of meals served and paid for by federal dollars every year. We're going to see real food, more real food, less ultra-processed food going into the National School Lunch Program, prisons, hospitals, and other federally funded organizations. This, I think it's a point that gets lost a little bit, that by just changing the dietary guidelines, it is going to trickle down into billions and billions of healthier meals for Americans. So I think that's step one. I think secondarily, we've got Dr. Marty Makary, an absolute hero, who is approaching the GRAS loophole, the generally recognized as safe loophole through the FDA. So this is a program where companies have essentially been self-reporting the safety of the ingredients that they're putting in their foods with very, very little oversight, which has led to literally thousands of chemicals in our food system that we don't know what they are or what they're doing to our body. By addressing this loophole and starting to have much more scrutiny about what's going into our food, this is going to trickle down to affect medical education, affect culture, affect what companies are putting in the food. The zeitgeist is going to shift about a lot of this because we're going to start to have transparency about what is even in our food system. Additional things are happening that are just incredible around food. There was just $700 million put forward towards regenerative agriculture. So we're going to have more investment in research and studying of soil health, water quality, nutrient density of food, and how that's affecting our health. That's going to trickle into medical education. There's a whole person health initiative at the NIH that's being put forward by Dr. Jay Bhattacharya, who's doing an incredible job. That's going to study this systems biology perspective of the body, not isolated silos, but the whole body health. And when we look at the body as a system like that, nutrition has to play into it. So this is just, 4 or 5 of some of the stones that are being moved right now that all will lead to nutrition being a bigger part of our healthcare system. I think where I can help on that is elevating the work that's being done, having conversations, again, across the whole medical community to help us in a really positive and unifying way move towards a more root cause approach to health.
You think that will be a hard item to push in our medical schools about nutrition?
I've had conversations with a number of deans of medical schools who are very, very passionate about this issue. They want to change. It feels hard because we have this behemoth healthcare system that operates a certain way. But right now, there's cultural momentum, there's political will, And I think the time is now to make generational changes that are going to have a huge impact on all Americans. And I also think it's an issue that all of us can work on together. It's non-controversial, it's positive, it's unifying. And I think that's what we need right now for Americans.
It's all about educating people. And sometimes people don't want to be educated, but I think the Surgeon General and our whole Department of Home Health and Human Services, I think everybody's on board with that. And if we do that, what Senator Sanders was talking about the $5 trillion a year we spend, we can't afford to do that anymore. I mean, we have to start, and the root cause is education. We have to educate people. Thank you very much.
Senator Baldwin.
Thank you, Mr. Chairman, and thank you, Dr. Means, for being here today. You spoke in your opening statement about building trust in public health. And you also made, I think, a passing reference to conflicts of interest within agencies in HHS. So I want to ask you a few questions on that point. Dr. Means, you've promoted a lab testing company, Genova Diagnostics, which is backed by private equity and may charge customers several $100s for its services. Before you began promoting their tests on social media, the company agreed to pay $43 million to resolve allegations that it had billed for medically unnecessary lab tests and violated the False Claims Act. You personally accepted $10,000 from this company. And I want to ask you whether you were aware of Genova Diagnostics' prior violations and the settlement when you started promoting their services.
Thank you, Senator Baldwin. And also thank you so much for meeting with me beforehand. I really enjoyed our conversation. Frankly, I was not familiar with that settlement.
So that's
there's a particular test that they make about nutrient quality that I find very compelling, because I do think we need to understand a little bit more transparently about how the nutrients from our food are affecting our health. And I would just highlight that I have worked extremely closely with the Office of Government Ethics over the last several months and taken this process very seriously. I've signed a letter that outlines how to rectify any potential conflicts. And I
know you're going to divest your
absolutely
stocks in all sorts of health-related and non-health-related entities, but it's troubling because the Surgeon General must be someone that the public can trust, and someone who does their homework before accepting money or lending credibility to a company. And for me, this raises questions about your judgment. It does not inspire confidence that you're here to make Americans healthy when you accept money to promote a company who's had to pay a settlement because of violating the False Claims Act. Dr. Means, you have also promoted a range of supplements, including those that claim to promote longevity and detoxification. You made at least $325,000 from promoting supplements since the beginning of 2024, according to information provided to this committee. This includes Health offers continuous glucose monitoring and AI-driven health insights. And a full membership, and I'm not sure what all a full membership involves, but costs $1,500 a year. And that's about a whole month's average rent for a one-bedroom apartment in Milwaukee, Wisconsin. So do you really believe that most Americans can afford to spend upwards of $1,500 a year on your supplements and programs? And is that one of your solutions to our nation's health problems?
Thank you for the question. I certainly don't think every American needs to be wearing a glucose monitor. I think that we have a monumental blood sugar problem in this country that underlies most of the leading causes of death in this country: dementia, cancer, diabetes, heart disease, stroke are all connected by metabolic dysfunction, elevated blood sugar. And my work on using entrepreneurship as a tool to bring and study new tools that can help us understand our blood sugar better, I believe I'm very proud of. And as I mentioned in my opening statement,
Thank you for
Yeah.
that statement and those observations, Dr. Means.
And that
You say
research
you
that we've
want
done
to
with the company
address-
is meant to benefit all Americans.
Yeah,
It does
and
not
that's what I
necessarily
want
mean
to
that
tie
every
up in my remaining 12 seconds. Dr. Means, you say you want to address chronic disease, but 1/3 of low-income adults have 2 or more chronic conditions. They need an affordable solution. Groceries are too expensive. Healthcare is too expensive. Health insurance premiums have skyrocketed because of Republicans' refusal to extend the tax credit and cuts to Medicaid. And 15 million Americans are losing their health insurance. People cannot afford their prescription drugs. So you've said that our healthcare system is broken, but it seems to me that you've spent your career sort of making money off the flaws in the system. And I'm left wondering how the American people are supposed to trust you to put their health and safety first, not profits.
Those are incorrect characterizations. I appreciate your comments, and I do look forward to working with you and on your priorities. And I absolutely am committed to giving Americans the best public health information possible. And like the comments I made prior, I think some of the movement in our administration towards making healthy food more accessible are going to impact all Americans in a very positive way. And I look forward to helping on that and many other issues that make healthcare accessibility much easier for all Americans.
Senator Husted.
Thank you, Mr. Chairman. Dr. Means, thanks for being here today. I'm going to try to get through pesticides and mental health for our children if I could. I want to thank you for what you're trying to do to raise awareness about healthy eating, healthy foods. And since your nomination, and though I've had a lot of questions from farmers in the agriculture community in Ohio about your comments on pesticides. And you will not regulate pesticides in your role, but your views will impact American consumers and what they believe about what's healthy and good for them. What is a pesticide? I would just put a little poster up here, and why do we use them? Because this is the kind of thing we try to prevent. This is an earworm. This is the kind of thing that destroys our crops in all across the country. Corn, wheat, soybeans, fruit, and vegetables. If we fail to use proper pesticides, it will drive down yields of 20 to 50%, even more for fruits and vegetables, the very things we want people to eat more of, which will restrict the supply chain, make food less accessible and more expensive if we can't have proper crop yields and use more land, more resources, et cetera. And so given all those facts and given what the concerns are, please just share your views on pesticides for what they mean to the average consumer of food in our grocery stores.
Thank you, Senator Husted. And thank you so much for meeting with me prior to this hearing. This is a very complex issue. And what I would just want to start by saying is that I have the utmost respect for the American farmer. And I think just like doctors, farmers are in an impossible situation right now. Where we have developed an agriculture system that is dependent on chemicals that are toxic to have an affordable food supply. And that's not good for farmers. It's not good for consumers. It's a complex issue. And obviously changing anything overnight would be devastating to the American farmer and the American consumer. With that said, this administration is committed to understanding what's in our food and how it's affecting our bodies and how cumulative exposures to various chemicals in our environment is affecting us. And that is a core, profound, long-term, deep passion of mine as someone who thinks about how our environments and the system that we live in is affecting our health in the midst of this monumental chronic disease epidemic. And certainly pesticides, herbicides, insecticides is something we need to look into as part of that cumulative exposure. So it's a complex issue. It's very sensitive for farmers and for American consumers, especially mothers, because we want to have the safest water and the safest, food supply in terms of what's on it. But I understand the nuance of these issues and that changes need to be made thoughtfully, with full respect for American farmers and the constraints that they're under. And also, eventually, we are going to need to move towards a more sustainable way of growing our food that decreases our reliance on toxic chemicals that are hurting human health. I think there are incredible movements happening within the administration. Like I mentioned, the $700 million going towards regenerative agriculture transitions, precision agriculture, and the private sector collaboration that may be using technology to help be more precise with pesticide spraying. And I think those are all positive developments. But at the end of the day, we do need to understand how these chemicals are affecting our bodies and work towards creating the safest.
Great.
food
I
system.
have one more, three quick questions for you. It's on mental health of our children. And I'm going to ask all three of them to give you a chance to respond. Do you believe that smartphones and social media are negatively impacting the health of America's children? What age should a child have access to a smartphone and social media? And what would you recommend? Would you recommend banning smartphones in America's schools?
I believe that the research is showing that the impact of social media on children is profound and negative, and we need to take great efforts to protect children from premature use of technology that is associated with mental health issues and depression. And it's a strong concern of mine.
And what age does the research say that we should have, give child access to a smartphone?
I don't have the answer to that question. I don't know if an exact number is known, but I think in light of how quickly things are moving with technology and social media and how rapidly things are changing, we need to, as parents, communities, schools, and a government, exert an abundance of caution and be very proactive about making sure we're protecting children and their mental health.
I hope you'll spend some time talking about this issue in your role as Surgeon General, because if you go to a school that's banned smartphones, they will tell you it has a profound
Absolutely.
difference on the mental health and the educational environment in those schools. So thank you.
Thank you.
For being here.
We'll now go to Senator Murphy, and for the awareness of the members, after Senator Murphy, we'll take a 15-minute break for the benefit of Dr. Means, more importantly, the benefit of her child, and then we'll return 15 minutes as said.
Thank you, Mr. Chairman. Good morning, Dr. Means. Dr. Means, are you familiar with FTC policy that requires those who are recommending products online to disclose their financial connection to those companies? In particular, the document from the FTC says this: if you endorse a product through social...
इन दोनों में से तो कुछ भी अच्छा नहीं लग रहा मुझ पे। शादी पर जो गिफ्ट्स मिली थी ना, उनमें से कुछ पहनती हूँ। बस 2 मिनट।
ओके। अवीरानी 2 मिनट में रेडी हो ना हो, कुकू टीवी में मिलते हैं 2-2 मिनट के माइक्रो ड्रामा एपिसोड्स।
अविका, और कितनी देर? 8 बजे का रिजर्वेशन है।
बस आ रही हूँ, 2 मिनट।
ठीक है।
30 मिनट का ड्रामा अब बस 2 मिनट में।
आई एम रेडी, चलती है।
बेबी बस 2 मिनट।
सिर्फ कुकू टीवी पर।
Any of the products you recommend, you did not transparently reveal your financial connection. Let me give you an example.
That's false.
Well, I'll give you an example. So there's a prenatal vitamin called Wenatal. Your filings before this committee show that you started receiving compensation in the spring of 2024. And yet in September of 2024, you posted a video saying that you had no financial relationship to the company, just a big fan. And then in October, you said, not sponsored, just love these. But in fact, you have documentation before this committee that showed when you said those things, you had a financial relationship. You had already started receiving money from that company. So you weren't telling the truth when you said you were just a fan. You were actually receiving money, correct?
If in any post where I said I am not receiving money, I had not been receiving money at that time.
But you had received partnership fees for this particular prenatal vitamin. In fact, prior to September and October, you had posted partnership links in which you get compensated based upon click-throughs, correct?
I'm happy to look at whatever documentation you're talking about, but I do not, it's incorrect and it's a false representation. And just to be very clear, I've spent the last several months working with the Office of Government Ethics to be fully compliant with this process. I take it very seriously. Before, during, and after, if I am in office, I will be in full compliance with the Office of Government Ethics. I think, as I've talked about, conflicts of interest are incredibly important to rectify if we're in public service, and I am fully committed to continuing to work with them.
So let me give you some other examples. Function Health, which is your lab testing platform, data shows that you disclosed your partnership with them less than a third of the time that you recommended their services online. Genova Diagnostics, you disclosed your sponsorship in only 2 of the 9 times that you promoted Genova. Daily Harvest, you disclosed your sponsorship in only 3 of the 14 posts recommending that product. Zen Basil Seeds, you disclosed your partnership only 2 out of the 13 times that you recommended the product. This seems systemic. It seems that in the majority of instances in which you were, as a medical professional, recommending a product, you were hiding the fact that you had a financial partnership. You seem to be in regular willful violation of the FTC rules. That is concerning, as someone who agrees with Senator Cassidy that our focus has to be on restoring trust in the medical profession. And yet over and over again, you seem to be at scale recommending products without telling your followers. And you have 200,000 newsletter subscribers. You have almost 1 million Instagram followers. And in only 3 out of 14 times on Daily Harvest, when you were promoting Daily Harvest, you disclosed that you're getting paid by them?
It sounds like you have a lot to say about this issue, and I would be very interested to see how your staff looked at this data. I have a strong feeling that the way in which they gather this data is done intentionally to create these claims that you're making.
Well, I have the backup here. I mean, will you acknowledge that in many instances when you were promoting these products, you did not disclose that you had a financial relationship?
I don't think that's true. If it has happened, if it inadvertently has happened, I would rectify that immediately. However, I would be interested to see how your staff gathered
I'll
this
be
data.
happy to send it to
And
you.
I will conclude by saying
I'll
that
send it to all the committee members. I mean, it's pretty incontrovertible evidence.
I take conflicts of interest incredibly seriously. I've worked diligently with the Office of Government Ethics to make sure that conflicts are addressed thoroughly.
The committee will stand in recess for 15 minutes.
Thank you.
In chess, the right move at the right time changes everything. I made the right move when it mattered. You can too with RBL Bank. Need quick funds for business? Make your move with a loan against gold ornaments. Great choice. Need to grow further? Go for a loan against property. Great going. Take the next big leap with a business loan. Give your business the right tools, the right support, and the right partner to grow. RBL Bank. Apno ka bank.